to Professor Don Bundy, who is a Professor of Epidemiology and Development in the London School of Hygiene and Tropical Medicine. He is the director of the new Research Consortium for School Health and Nutrition of the School Meals Coalition. The fascinating path leading to his current role includes being a professor in the Epidemiology Centre at the University of Oxford, a lead education and health specialist to the World Bank, and a senior advisor to the global health team of the Bill and Melinda Gates Foundation. So we're looking forward to your perspective, Professor Bundy. It's all about the research. How can the global research community help fill evidence gaps and advance more effective approaches to school health and nutrition? Thank you so much.
Great, thank you very much, Dr. Gray. And I think we're going to kick off, aren't we, with a video to, I think that's being shown from your end.
Sorry, Sylvia, please.
Next, we will hear from another commitment to action, this time around a very important initiative that has attracted a lot of interest this past year, and a half against a backdrop of closed schools and lockdowns. I am delighted to give the floor right now to the School Meals Coalition.
Finland has been actively promoting the establishment of the School Meal Coalition.
Argentina ha adherido a la coalición de comedores escolares.
Mon pays s'attelle à la mise en œuvre de cantines scolaires en privilégiant leur approvisionnement auprès d'acteurs locaux.
The African Union Development Agency, NEPAD, has worked to facilitate an African common position in advance of this summit with the following priority tracks. 1. Adopt nutrition food policies, establish food reserves, and expand school feeding programs.
I am pleased that Kenya is taking leadership in the School Meals Coalition.
The Agriculture for School Lunch project is one of our success stories in addressing food insecurity and malnutrition.
So as to deliver safe, healthy, and nutritious school meals.
Our support to the School Feeding Coalition.
Guatemala se adhirió a la coalición de alimentación escolar.
And we therefore support the coalition on school feeding and commit ourselves to achieving the goal.
School meals.
The school meal.
Y es que firmamos la coalición para la alimentación escolar.
We are pleased to have joined the School Meals Coalition.
My country, Luxembourg, is particularly proud to join the School Meals Coalition. The establishment of effective school meal programs represents a smart investment into future generations as well as into more sustainable humanitarian action and development aid.
We look forward to working with so many of you through the global coalition called School Meals, Nutrition, Health and Education for Every Child, to ensure that every child has access to nutritious meals in school by 2030.
La Principauté a annoncé son soutien à la Coalition pour les repas scolaires, nutrition, santé et éducation pour tous les enfants.
Coalition sur les cantines scolaires.
Schools Meals Coalition.
La Coalition des programmes alimentaires scolaires.
School Meals.
School Meals.
La France appuie également la Coalition pour l'alimentation scolaire.
We already support the School Meal Coalitions.
Bénin s'est engagé à jouer un rôle prépondérant au sein de la Coalition mondiale pour l'alimentation scolaire.
I'm pleased to see many member states rallying around universal access to nutritious meals in schools. A great example of how social protection can support resilience, food security, and the rights of children and young people.
Join us, sign the declaration, make your commitment known, and help the School Meals Coalition ensure that every child has a healthy, nutritious meal every day. Thank you for joining us today.
Great. Well, thank you all. I thought I started at that because I felt it was important to show that we really had a global movement here on the issue of school meals and school health, and that's really describing what happened in October 2021 when the UN summit focused on the issue of food and nutrition. So all of those countries came together. It's now 79 countries. Here's the map. It's a truly global initiative with more than half of the world's population being in these countries backing this work together. And the point that I really wanted to make was that, that I've been asked to talk a bit about what should countries do, but I wanted to explain a little bit about what countries are doing to identify the gaps. And I also want to make the point throughout this presentation that if any of you want to be part of this initiative, you're very welcome. This is a global effort, and it's a truly global partnership. So let me try and explain a bit more in the detail of what that's about. So let me just say first that the goals of the School Meals Coalition, the 3 goals. One was to build back the school meals programs to the size they were in 2020 before the COVID pandemic. So in those days, 388 million children, nearly half the world's primary school children were being fed. Get back to there. Secondly, reach that 73 million children who've never been part of the school meals program, the most vulnerable children. And finally, to really build programs that take into account not just meals, but the whole health and development spectrum for young people. Chris Castle's presentation at the beginning, just super, I think, about explaining about learning and thriving and how those two things are part of the development of a young person into adulthood. The next slide, just give you an idea of the research dimension. So all of those countries we heard of, as I say, now 79 countries, decided that they needed to understand better what's the evidence for how best to intervene in school meals and school health. What are the evidence gaps? What is it we should be doing about it? And they asked for the establishment of a research consortium for school health and nutrition, a global consortium to support the Global School Meals Coalition. And here's the structure. All the countries are the boss, the countries are on top. There's a very small secretariat at the London School of Hygiene and Tropical Medicine. That's where I'm based. But the real work of all of this is done through a series of community of practices. And I'm going to go through each of those six communities of practice. These are spread across the world, and as far as we can, we're trying to deliver equitable partnerships. In other words, opportunities for everyone to really lead, to provide thought leadership on this work. And we'll only do it if you join. So please join. So what are these communities of practice? The first one I want to talk about is analytics and metrics. This was one of the first that was established. It's a community of practice that focuses on two really main issues. One is value for money in school health programs. What's the return? We've seen several figures, $9 for every dollar invested, for example, but also very specifically asking questions about education returns. What's the benefits to a child of well-being in terms of their ultimate educational achievements? It's a key part of the question. So that's one area of work, and there we're working already in 8 African countries, programs led by the countries themselves in multi-sectoral programs with local scientists as part of the team, and also very specific studies. One particular one on impacts of malaria on learning outcomes. Well, the next community of practice is the impact and evidence group. Back in 2007, many of you will be aware of a study that was led at that time by Betsy Christensen from the University of Ottawa. Well, Betsy's leading this one, but she has a very large team across the world helping her look at all the studies that are available in this area. In 2007, when the last systematic trial was run, there were 18 studies. Now there are something like 70 studies. So we were just waiting for the results of that systematic trial, which will likely to be in the next few months. But the next example is itself a good example, and this is actually a core issue. This is really what countries are interested in hearing about. This is a group that's looking at the case studies for individual countries. The aim is that all 79 countries will, in the end, submit case studies. Already there are more than 20 case studies ongoing, studies in Malawi, Canada, France, Japan, and the USA, across the world, studies that are going to provide evidence for what programs are like. And I just bring your attention to Professor Ma's excellent presentation on the situation in China and how much we could learn from her description of the case study. I hope Prof Ma will be part of the case study development for this community of practice. And the next one is the nutrition measurement community of practice. This is one that looked at the extraordinary reality that we really don't have indicators for measuring nutritional development, standardized indicators in school-age children and adolescents. And indeed, much of the nutrition work is not focused on those age groups, but focused on much younger children. We need to think of course, we need to support the young children, but we need to also maintain great support throughout the childhood. And I particularly enjoyed Dr. Olumide's presentation on the program in Nigeria, which has shown spectacular growth over the last 3 years, from reaching 1 million children to reaching now 10 million children with nutritious meals based on locally grown foods. Fantastic. These are the kinds of issues that we're getting into. And then the next community of practice is one which I'm hoping some people listening to this talk will participate in. This is for early career researchers and young scientists. No one's too young to be part of this. The idea of this is to encourage people to adopt careers where they look at this interface between health and education. It's not a traditional area of research. We need to support people to take them forward on that. This community of practice is being formally launched in a week or two on the 4th of May, and I hope you'll all be part of that. And finally, the most recent community of practice is diet and food systems. So this is about, okay, nutrition's vitally important, but can we support a menu in school that's based on locally produced foods? We heard from Dr. Olumide that was being done in Nigeria. We know, of course, that's also done from Professor Ma in China. But why do we understand, how can we understand those connections better? And as a high point of this particular piece of work, there's also a presentation being developed for COP28 in Dubai later this year, a climate smart approach to school meals, which we're working hard with a group across the world to try and develop a clear common vision of what climate smart school meals programs would look like. Well, I want to finish on a very high and positive note. We heard from Chris Castle about 388 million children who are being fed in 2020. And you'll remember that the first goal of the School Meals Coalition was to build that back. Well, we can all start clapping at this point, because indeed that's been achieved. That in the survey conducted last year, 418 million children again are now being fed in these programs. That doesn't mean we're reaching all the children that need it. We're least effective where we need it most. Lots of more work needs to be done. But this is success, and it's a sign that the governments really have got behind this issue. And finally, this is the slide. If you want to join us in any of these ways, and we look forward to connecting with you and working with you as we move forward in this area. Thank you. Thank you, Dr. Gray.